Doctor, thank you so much for joining us this morning.
Thank you for having me.
Of
Very
course,
excited.
I'm glad you're here. And the question we're all pondering on is the linguist and, being part of a health conference. How are these two interrelated and how did you become part of it?
That's a good one. As I said, I'm very grateful to be here this morning. And the question of being in a conference that deals with health, medicine, life sciences is an interesting one because as a linguist, how do you find yourself there? I always say linguists have a place everywhere and anywhere, because what do you do without language? What do you do without proper communication? What do you do without speaking correctly on and about an event? On my part, as an applied linguist, I fit properly therein because my PhD is in healthcare communication.
Okay.
So it's a combination of applied linguistics and communication, and specifically healthcare communication. So when it comes to how healthcare matters, how healthcare provision, how healthcare reception, and how healthcare is communicated generally, I think I am very well placed to be where I have been.
Absolutely, of course, yeah.
Yes.
And also just you had your papers accepted for presentation at the conference and, publication as one of the partner journals or in one of the partner journals. Just talk to us about what that entailed.
All right. For an academic like myself, there is a common phrase or a popular phrase that in academia you either publish or perish. So in addition to the teaching, the mentoring, and the administrative tasks that we have at university, we also are expected to do research. To grow in academia, you've got to do research and to publish. And research includes that you do research, you present your findings at conferences, and then you also get this published in journals. Usually we say reputable journals, but there are also smaller journals, topic for another day, smaller journals like the ones of our own in Namibia, for example, that you would say they are not accredited or the likes, but there should be good papers published in those journals so that they are accredited, because the accreditors look at the qualities of the papers. But as we combine our efforts to make sure we uphold local journals, we also reach out to publish in renowned world journals so that our researchers go out there and get indexed. But we also put them in our local journals so that the local research impacts the local people, because we do research so that we have solutions to our local issues and challenges. For example, in my case, I really look at the multilingual, multicultural, and double multilingual nature of the Namibian society, where you have a lot of languages, a lot of cultures already within the country, and then you receive healthcare providers who are from different cultures, who speak totally different languages, and it's a whole cocktail of communication experiences that need to be carefully handled.
I like the point that you said it's a whole cocktail of communication that needs to be handled. And just in terms of local researchers, what do you make of, the platform and opportunities provided here in Namibia?
As academics, we unfortunately, are continually involved in research. The question that you ask is perhaps what happens to the researchers that we continually do. Because as universities, for example, I am definitely not here to speak on behalf of NUST per se, but as an academic myself, I understand our mandate is to do research so that these researchers can impact and contribute to solving our local and national issues.
Absolutely.
So the local research that we do, I feel as a country, we need to proactively gather around the table and collect all those findings and researches that have been carried out by so many people who put in a lot of effort and money, so that we put them to practice.
To practice,
we,
yeah.
we have them, you know, because there are a lot of solutions in those researches, a lot. But sometimes they just collect dust in libraries and
Not really
in thesis
utilized and
books and not really brought to life
yeah.
to solve the issues that they are supposed to solve. I think we need to close that gap. How is a
Discussion for another day and to be discussed at a different table. But I mean, like you highlighted, you're of course among some of these researchers and academics from this field and their related, disciplines. Maybe just talk to us about the different countries that were involved and perhaps also just your engagement, the knowledge gained and how it can be of benefit, for us and how you'll be applying it in the context of Namibia, of course, when you talk about health medicine and life sciences.
All right. No, thank you so much. The conference was structured in an interesting manner. We definitely had attendees from all over the world, a good number from all over China, different provinces or regions, and then we had some professors from the UK, from the US. We had some professors from a number of them from Africa. Africa was, after all, well presented. From Namibia, a colleague from Zambia, two colleagues from Nigeria, one from Ghana, one from Cameroon, and the other one from, I can't remember now. And then this represented, and another one from South Africa. So now, of all of us who came, we had two types of presenting data or research findings. I, for one, did an oral presentation. I spoke to my findings. And then other colleagues had an opportunity to do poster presentations. So there were poster exposition. So we would have then a session, a full, almost 2 hours, looking at the posters and the colleagues speaking to the posters that they prepared. Most of these posters would be on practical findings on health matters. I remember vividly the colleague from Zambia who looked at animal health and how this type of diseases travel from region to region, from place to place, and looking at the geographical characteristics of places and how this bleeds different types of animal ailments. It was very interesting for me. And then we had about 3 keynote speakers, and these keynote speakers shared a great deal on issues like heart diseases and why do we have now a lot of cardio attacks and all those things. And on my part, when I had to do my presentation on putting together all this and how this should be communicated, and I was the only one who came from a kind of a related discipline, but part of the discipline, who spoke about, while you speak about all this, how do you put it together? How do you bring it across the people? How do you make people understand? How do you communicate so that the message about prevention, about health improvement are clear? That for me, and as I received feedback, was something new to the conference. And this year it was an 11th conference. And I believe, and I was proud, yes, I believe I've made an impact in that regard. And of course, and having it accepted to be published, that's also another step that I really appreciate with the work we do.
Absolutely, we do appreciate it too. And just to add on something that you highlight earlier in terms of how communication works and so forth, perhaps you can just expand a little bit on why it's important for languages, what is the importance of language in various fields?
Okay. No, thank you so much. Language cannot be overemphasized because it's a communication tool. Now, I'm a communication and a linguist. I sit in these two places. As a linguist, you need to know your linguistic tools and how well to use them. What does this mean? You must, if it's for you to communicate, you must be time conscious. You must use your grammar correctly. You must use your tenses correctly. You must use your sentences correctly. You must make sure that you use simple language that is understandable by everyone listening to you. You must be aware that what you say and how you say it and bring it forth in your mind to your audience. Will they understand what I mean? Now, then that bridges into communication. As a communicator, how do you communicate? Anything, about anything. Water, a linguist should be there. A communication expert should be there. Green hydrogen, anything. Language and communication are very key, because do you know that a lot go much so wrong because either the communicator was unclear in the manner they communicated, or the language used was ambiguous, was fake. You didn't really say what you want to say, and therefore people understand you the way you say it. And then you say, no, but I meant, no, if you meant that, just say that. So do not, many times people assume, communicators and linguists perhaps, but generally human beings have a tendency of believing that because we are here, everybody listening will understand. Assumptions are very dangerous in communicating and in language usage. Specifically in my area, in healthcare communication, if you communicate vaguely or ambiguously, you make it difficult for anyone to help you. If you are a physician or a healthcare provider, you make it difficult for the patient to come out and explain to you, because they don't understand, after all, what you mean, maybe by the question you asked. And also as a patient, for example, if you speak in a manner that the person doesn't understand, especially our English in Namibia, you tend to go home with wrong medication. You tend to go home not sure about what and how the physician explained that you take your medicine or your treatment plan and so forth. So language is key in every area, and we should educate our people to communicate. You see, maybe one little joke, when we were around grade 10, grade 11, we used to learn these big words because we want to impress with these big words. And as one proceeds into academia, you realize that it's all right to impress sometimes with your big words, but they lose people. They lose your audience. So the best way to communicate is to use your simplest of the words that you have, so that you don't lose the message and that you don't lose the people that are your audience. And the message as well, so that it goes out clearly to everyone as you intend
Especially
it
for
to.
the layman person, absolutely.
It's especially for the layman.
Just as we conclude, Doctor, perhaps you can also, I know you said it's a topic, a discussion for another day, but just briefly, perhaps just break it down for us on how we can fill the research gap in our country and in our institutions as well.
All right, no, great. I would say, perhaps to begin with, we have institutions. In as much as for example, we have various type of universities. We've got UNAM, deals with training nurses, doctors, Velvicia, IUM. We've got these universities, and then we've got the department or the Ministry of Health and Social Services in the country. And we've got all other related departments or bodies like your Health Council, your National Health Council, and so forth. And the Ministry of Health, the Health Council of Namibia, are aware that there are researches that are constantly happening in these universities. I think what I feel is that the two bodies should constantly be in contact. There should be a research body in the Ministry of Health that always looks for studies that are novel and that are dealing with issues that they have concerns with within the ministry, because I assure you, those researches are constantly happening. And it's the same with the Ministry of Education, for example, the Ministry of Rural and Urban Development, and every ministry, if they can just find the departments and the faculties within universities that trains their workforce, that trains their people, they will find solution to many problems, because researchers are constantly doing research. I assure you we have researchers from an honors degree, we've got masters who are doing researchers, with PhD candidates who are doing researches constantly, and most of these researchers collect dust in our libraries, in our repositories, and they have solutions to the problems that we even go look for big funds to go and redo.